The V.
Oh, good.
Vagina, vajayjay.
Vajayjay.
My grandmother, she had two names for it. Pocketbook. What? And Candy Girl.
Candy Girl?
I like that one.
Okay, I've never heard that one. That's new to me.
Any nicknames?
No.
Even with your honey calls it maybe?
I always just said vajayjay.
Vajayjay.
I can't tell you what he calls it.
Secret.
Everything that's wrong in my life right now, I blame on menopause. Everything. The weight gain, weight gain.
Yes.
Weight gain,
What
weight
else?
gain, fuzzy hair.
Or hair loss. If I keep losing hair, I'm gonna look like a shaved chinchilla pretty soon. I mean, it's ridiculous. With the hair, I'm like, what's going on here?
The brain fog.
Oh my God. My new phrase is thingy. Honey, could you go in the room and get that thingy for me? It's like whenever you forget what you're saying, it comes back to thingy.
They're supposed to be mind readers, you know?
But you have to do the hand motions with, the...
Exactly.
So today, we are truly keeping it real. Can you tell? Because there are so many misconceptions about menopause and the vagina. In fact, we're kicking off a 5-part series called Take Back the Bedroom. And we're just going to call it Vagina 101. There, I said it. Helping us out are 2 experts, sexual medicine and board-certified gynecologist, and our resident sexuality expert for the show, Dr. Michael Krychman. And joining him this morning is Dr. Alyssa Dweck, an author and board-certified obstetrician and gynecologist. Good morning to both of you.
Hi.
So, vagina. It's like, you heard those women talk about it, the nicknames they've given it. I applaud them. I gotta tell both of you, I applaud them for talking about something that happens to all of us, yet it's still taboo, doctor.
Right, and
Why?
it absolutely should not be taboo. The good news is that this is becoming more a regular conversation that we're having in the doctor's office, and there's nothing secret in the gynecologist's office. We've heard it all. We're used to hearing unusual situations and circumstances, and we are ready to talk about it.
And Dr. Krychman, do you feel women are coming out and talking about it, or are still a little hesitant there?
Well, I think they're still a little hesitant. I think that, with the menopause, most women associate that with hot flashes and sweating and problems sleeping. But when it comes to the vagina, just as you did, right? You said, vagina. We really shouldn't be whispered. It should be screamed.
It should be
Every
screamed.
woman's having one, right? And every woman's going to go through menopause at some point.
Right.
Maybe not now, maybe not today
But
for
it's
you.
gonna happen.
But at some point. So I think it's really important to break the conspiracy of silence and start talking about it, because dryness not only affects vaginal health, but it also can affect relationships, intimacy, sex, and what have you. So I think it's really important to start talking about it.
So let's talk about it. Menopause, Dr. Krychman, the vagina, the vulva. What's going on when menopause hits?
Well, when a woman goes through menopause, we see a lowered estrogen, the primary hormone for women that maintains the health of the tissues, of the skin, and that helps it maintain its elasticity, its stretchability. But when you go through menopause, this falls, and then you can get dryness, you can get pain, irritation, redness, even chafing. Even wearing clothes can be really irritating. Women with severe dryness feel their vagina all the time.
Absolutely.
So I think it's really important that this irritation, there's safe, effective things that can be done to help women.
And doctor, the age varies, right?
Right, well, the average age of menopause when you haven't had your period for a full year is 52.
Okay.
However, there's a transition for about 10 years prior to that time where women may start having symptoms that are perimenopausal, such as hot flashes, night sweats, the vaginal dryness that we're speaking of. But I think it's so important to let everybody know that menopause is not a disease. It's a natural phase that we're all going to go through, and there are ways to manage symptoms so that you feel amazing.
And the vaginal atrophy, as it's called, dryness, it's very painful, like you said, doctor. What can women do to help alleviate that and still have great sex with their husbands?
Well, I think it's important to recognize that even that word, dryness and atrophy, it sounds like this shriveled up old thing, and
Like a
nobody
prune.
really wants to be associated. It's not your grandmother's menopause. A 51-year-old woman is active, vibrant, she is running a corporation, and sex is really important. And there's products like Lubrigyn that are safe, effective, they have great ingredients like hyaluronic acid and elastin that really help hydrate, keep the tissue supple. They help cleanse. The Lubrigyn cleansing lotion is something that you can use on a daily basis to help stay fresh and stay moisturized so you're not experiencing these troublesome symptoms.
And when your patients have used it, doctor, do you feel they have a better outcome?
Absolutely. I recommend Lubrigyn all the time, especially to my patients who are going through perimenopause and menopause, but those who suffer with symptoms of dryness or irritation on a regular basis.
Feels great.
It feels great, and it has a really nice fragrance that's very mild and subtle, but I think that it's important that we start to transition to really taking care of our intimate skin. It's very important, just like we do with our face.
Right, and a woman's going to spend 40% of her life in the menopause. 40%. That's a
Are
huge
you
amount
kidding?
of time.
40% of my life, I'm
And
going
you
to...
want to be active and vibrant and enjoy intimacy with your partner. I think it's really important
It
to
is.
let
It
women
is.
know that there's things that they can do.
It's also liberating. I think that's a new way to think about menopause. It's a liberating time, and we should embrace that.
For more information on Lubrigyn, where can we go?
LubrigynUSA.com.
Thank you so much. Appreciate your time.
Thanks for having us.
And of course, if you'd like more information on this discussion, you can go to our website, and that's thebouncingAct.com.